Kuzambo and welcome to a special discussion on children's environmental health and safety. Today we'll be discussing about lead exposure, a subject which many of us may not even think about, but which is silently harming children across Bhutan. According to the National Blood Lead Level Survey conducted last year, about 3 out of 4 Bhutanese children aged 1 to 6 have high levels of lead in their blood. The report also states that any level of lead can affect brain development and overall health of a child. Now, surprisingly, the sources weren't industrial waste or factory fumes. They were items we use every day, such as kitchen utensils, religious items, and even children's toys. In response, the Ministry of Health has launched a nationwide campaign to raise awareness among communities. To help us understand more, I am joined by Dr. 𝗨𝗲𝗱𝗲𝗿, a pediatrician at the 𝗵𝗲𝗍𝗂𝗂𝗂𝗃 National Referral Hospital, and Mr. 𝗵𝗲𝗱𝗲𝗿, a program analyst at the Ministry of Health. Doctor, let's start off with the basics. If you can tell us, what is lead poisoning and why is it dangerous, especially for children?
Thank you very much for taking this very important health agenda forward. Lead, as such, is a heavy metal which is present in the environment, and there are certain areas where the lead, the concentration of lead can be very high, and when it goes into the child through different mechanisms like breathing, maybe by ingestion or through contacts, then it can cause a harmful effect. Lead is basically a toxins that has harmful effect on the growth and development of the child ingest.
Yes. Can you tell us in detail maybe how lead exposure what kind of problems it can cause?
Lead, like when it comes to children, what we have to understand is children are different from adults in many different ways, and that we have to understand. For example, the lead can go into the body through different routes. One is if the lead is present in the environment, in the air, then when the child breathes in, he will inhale particles and the air containing lead, and that goes into the body. So by virtue the child's dynamic physiology, they breathe relatively faster, they need more air compared to their body weight, so they will be breathing more as compared to adult. That is one route. Yes. And the other one is child need more food in terms of their weight relatively, so they have to eat more. When child eat more, and if the food or the environment is contaminated, the food laden with lead, if it is contaminated with lead, can go into the body and child will absorb into the bloodstream. So if when the child crawls around in the room and if the floor has particles containing lead, then by virtue, like many of the children have hand to mouth behavior. Yes. And then they put the contaminated hand on the mouth, and then they swallow it and it goes into the body. Other routes are like through skin. If you have an environment that's having a lot of lead, for example, places where we use old batteries, in the workshop areas, and if the lead has contacted the skin, the child's skin absorbs more readily these toxins than compared to adult, and the child is will get contaminated or lead poisoning. And the other route is like if a pregnant mother has a lot of lead in the blood by virtue where she stays, then the lead can go from the mother into the fetus who is inside the womb. So these are different mechanisms of the lead entry into the child.
Yes. Thank you, Doctor. I'll be back with more questions. Over to Mr. 𝗙𝗏𝗻 now. The Health Ministry has been conducting a series of awareness campaigns, and you are one of the team members who's going around meeting with people. So if you can share the details, where have you been to and what have you found out?
And thank you PBS for organizing these events. This is a very important agenda, and I think our countries is now emerging in terms of the lead exposure in the country. As per the last year's national blood lead survey, I think we had found different types of sources of lead exposure in the communities. So based on that, then we know the Ministry of Health has initiated the lead source tracing at the different locations, mainly at the town where shopkeepers sells the products like food items, hardwares, cosmetics and everything. So during that time, now we wanted to trace out whether based on the last year's finding, whether there's any differences between last year source finding and this year source finding. Yes. And based on that, now we have so far we have went to almost 9 towns, districts to trace out the source tracing of lead exposure, which items has the lead exposure, lead content. So far we have went to 9 towns.
Yes. So has there been any interesting findings from the trip so far?
Thank you, sir. Compared to last year, I think the findings are almost the same, like mostly the spices, then even the kitchen and hardware items and other like mostly the religious items. We have, I think, almost same. But now we wanted to prove whether that is really the source of lead content in the country. So now we have went in 2 different. We have 2 teams. Now one team with for the source tracing, we use the XRF machines, which is that we have used during the national blood lead survey also. So we are using that XRF machine, and we went to districts to the lead source tracing.
Yes. Thank you, Mr. Kamala. Doctor, I want to reveal some data from the national survey conducted last year. As part of the survey, about 2,000 children aged 1 to 6 were studied, and from that 76% had high lead levels in their blood. About 51% exceeded the threshold considered concerning by the World Health Organization. About 120 pregnant and breastfeeding women were also tested, and about 60% of them had elevated lead levels. Even in the monastic institutions, over 200 children were tested, and 86% of them had elevated lead levels. So, doctor, looking at these numbers, what do they mean for children's health and development in the country, both now and in the long run?
Now, there is a very alarming data that came out from the national lead survey, and contrary to our belief, like we used to think we may be safe from the lead, the result came out to be otherwise. And in terms of health impacts of this finding to our population, especially like the pregnant women, we start with pregnant women. If there is high lead level in pregnant women, it can lead to complications like miscarriage or abortions, and the baby who is growing inside the mother's womb will be having restricted growth, and then it might lead to premature delivery of the baby. There will be impairment of growth in terms of brain and all those things. So when the baby is delivered, and if the exposure continues, then almost every organ system in the body is affected by lead. Yes. And to start with, child will have intellectual and developmental disabilities. Yes. From the brain, and then initially the children may not come out with overt signs and symptoms, because it's a silent killer, or it has a silent effect. So over the period of time the leads will build up, but if the lead has gone into the body, the effect it has may or may not be reversible. So it is a cumulative effect. If the child continues to acquire lead or continues to the exposure of the lead, then the effect will be cumulative. Yes. And one thing we have to know is there is no safe level of lead in the blood. Whatever lead is there, it will have an harmful effect. And like I have told, mostly in children who are worried about intellectual disabilities, developmental delays, encephalopathy, where the brain will not be able to function as normally as we would like to be. And then they may have come out with behavioral problems. Yes. Depending on the lead level. And then if the lead level increases, then other organ systems like the kidneys will be affected. No wonder we have so many children with kidney problems. We want to find out and correlate whether this lead has anything to do with the children having kidney problem. And lead definitely leads to low level of hemoglobin in the blood. So lead can lead to anemia. Child will not be able to perform as good as the other children can do in terms of physical activities and maybe in terms of academic activities. And likewise, so many like kidneys, the brain, the blood, behavior, are affected by lead in children.
Last doctor, now I want to ask you, like, in your practice, have you come across any children who have been badly exposed to lead?
As you know, like Bhutan, now we are making progress. We are a developing country, and we do have a significant number of children who are having learning issues, learning disabilities, has developmental delays, and maybe some speech problems, some behavioral like attention deficit hyperactivity disorders. We do have children with signs and symptoms, but as of now we have the data of high lead level in the children, but we cannot for sure tell that this high lead level has caused this thing. We need further research and some kind of analysis to determine whether lead has caused it, but lead can lead to that one, all these causes. So it can cause all this problem in the child, and for the child as such, for an individual child, if he is not able to do as good as his friends or his colleagues who are not exposed to lead, he is at a disadvantage. He is not able to do well in school. He is not going to achieve his potential. So there is academic loss, and he will not be very economically productive individual. It will be a burden to the family, maybe the community, and at large, like the country as a whole, because now we are aspiring to become intellectual society where it can have a lot of impact on our aspirations. So in terms of economic impact, as for the World Bank report, Bhutan might incur a loss of some billions of newton in terms of economic impact if we don't intervene this high lead level in children.
Yes, doctor, one question I would like to ask is, for a parent, how can you identify if your child is suffering from lead exposure? Are there visible symptoms?
The parents and as well as the community at large, what we should know is lead initially may not give some specific signs or symptoms. The symptoms may be like quite varied,
Yes.
But what our parents should know is where is the risk of lead exposure. What are the places we should avoid children from playing, especially the workshop areas where there is repair of vehicles and old batteries. Children, we should avoid or prevent children going to those places and getting exposed to this lead. And better not to store old batteries and all those spoiled batteries at home. Better to dispose them of appropriately. That is one thing. And the other one is like basic health and hygiene, preparing food and vegetables and whatever thing by properly washing, and to make it a habit, like children are asked to wash their hands thoroughly before meals, so that whatever the hand, if at all the hands are contaminated with lead, they will not be ingesting that. And some children have a habit of putting their hand in the mouth and then while sleeping. So it would be wise even to wash their hands before they go to bed, so that we can prevent that one.
Yes.
And what parents can do is they can mop the toys and utensils and the floor, mop the floor regularly, so that the children are at reduced risk of exposure to lead, if at all it is there. The other one, the most important, would be to feed the child a very nutritious diet, especially the rich in iron, calcium and vitamin C. Even if the child has ingested lead, for example, if we have nutrients rich in this calcium, iron and vitamin C, this nutrient will compete with lead in terms of absorption, and the lead absorption into the body will be reduced. And so these are all the ways how parents can reduce risk of exposure to their children. But if the children have some kind of recurrent abdominal pain, he is having some kind of behavioral problem, temper tantrums, chronically ill or anemic, then they might suspect, and then they have to bring. So these are the things that parents should know actually. And then even in the hospital, like when children come, lead is not the first thing that we think about. There are other common things, more prevalent things. But now it is time we should start taking some kind of environmental history, whether exposure is, pediatric environmental history, which will narrow down whether the child has risk of exposure to lead, then we can move forward.
Yes, thank you, Doctor. Mr. Karma, I would like to ask you about the awareness campaign. When you're going out and meeting with the families, the communities, what kind of awareness do they have? Are they aware about lead exposure, lead toxicity?
Since this lead is a very new topics in our countries, and I think now I think at the community level, I think most of the communities are not much aware of this lead exposure at the moment. However, we are trying to sensitize in terms of lead exposure in the various forms. Like now, so far we have sensitized the business communities and religious bodies, and even the local governments like DT and GT citizens, and even we have sensitized in terms of lead exposures, not only lead exposure, but even the children's environmental health to our health workers as well as the 𝗍𝗍 facilitators. So now I think, but at the moment most of the communities are not much fully aware on the lead exposure. So I think now Ministry of Health is based on that findings. I think we are now trying to take more sensitized awareness campaign in terms of lead and exposure to the communities levels.
One question is, you are telling us about the trace testings that are also being done besides, along with the awareness activities. So if you detect when you detect lead, do you also offer advices or guidance to the parents, to the families?
While conducting the lead source tracing and based on our finding, actually we keep the confidentiality. We maintain the confidentialities, and I think to the shopkeepers and everything. But we just say that if some items have the lead content in your exposure in the content, so I think preventive measure has to be taken. But we are not telling them that at the moment because of the confidentiality, because they might again, I think at the moment they have the huge amount, for example, huge items in the groceries or sometimes in the hardware items. So I think then if you just say that these items has contain lead items, so I think at the one go they cannot replace, and I think so, and their business might also be affected. So at this moment we just say that lead is very serious. I think exposure is, as said by our doctor, is harmful to our health, and we should prevent from lead exposure. So in future, so if you have, I think in future you should always emphasis on bringing the lead-free items in the market.
Yes. Thank you, Mr. Karma. Doctor, now I would like to ask about what kind of facilities do we have in the hospitals? I mean, in terms of medical treatment or even testing equipment, what do we have right now?
Like I was telling just in my previous thing, lead is a new thing to us. Though it was there for a long time, but the health impact and such a high lead level in the community, it is coming to our attention just now through this survey. And in the hospital, when children come, now what we do is we create awareness starting from the grassroots level where our basic health workers are there. Most of the trainings at almost 2/3 of the country already we have trained our basic health workers and health assistants who are aware about the exposure of lead and the environmental risk factors. And if at all the children come and then we suspect, because of the strong environmental history where they stay and the signs and symptoms, if they correlate, then we can give advice to the parents to reduce the exposure. In the hospital as such, at the moment we don't have a routine testing facilities. This is just a public health measure where we did the survey, but Ministry of Health and the Department of Public Health are in the planning phase where they will bring in more equipment and facilities where the testing facilities will start in the country and will be able to detect blood lead level in the children if there is a strong suspicion from the history and clinical examination finding. In terms of globally, there are different permitted lead level in the blood, though it has harmful effects. Some say less than 3 micrograms, some say 5 micrograms, some say 10 micrograms. But if the children has like something 45 microgram or 75 micrograms of lead in the blood, then there is facility to reduce the lead from very toxic, dangerously high level to a low level, but that treatment will not eliminate eliminate lead from the body. And the most important thing is whatever impact the lead has had already during the developmental phase, especially the brain, where lead will go and stay in the nerve cell, and some of the damage could be permanent, will not be able to reverse. The most important thing that we have to do is how to prevent lead exposure in our children through advocacy, awareness, and it's a multi-sectorial. We have to take a multi-sectorial approach from the import of good items to the safety measure in the workshop to religious discourse and preparation of religious items and all those things, and especially and other things are like vegetables and spices which are contaminated with lead.
Thank you, Doctor. Mr. Karma, besides the awareness campaigns, what else is the ministry planning to combat lead exposure? Are there any other activities that the ministry has planned?
Thank you, sir. I think based on the result of the National Platelet Survey, I think Ministry of Health has taken several initiatives for the last few months. I think to cite the example, number one, we just had developed a curriculum for the health professionals in terms of children's environment with focus on the lead prevention. So where I think our health workers and all the health professionals will be sensitized, and I think they will be able to provide the treatment or something in the near future to prevent that lead exposure. That was one. And other thing was that we have initiated since the source finding, I think 44% of the gene lab tested was containing lead in the gene lab. So I think Ministry of Health already now work with, and now we have I think removed the lead tetraoxides from the gene labs, and now in future we are planning to make the gene lab with lead free. That is second option activities that we have carried out. And third one was that we have now as a health or ministry's social media web page, we are sensitizing in terms of lead exposure and its prevention, and that will be continual. And other thing is that, as I said in the previously, now we are sensitizing mostly in terms of our different stakeholders in terms of lead exposures and its prevention. And third one is now in the near future, now we are at the, I think even we wanted to develop the national strategy on lead prevention exposure, so that what action has to be done, as this is the starting point. Now based on that national strategies and action plans, I think we will find out what action needs to be done. I think now we are at the developing stage. And another thing is that now we wanted to, based on the finding of the lead source tracings and other previous source tracing, we are now I think in the stage of developing the regulatory frameworks in terms of lead consumable items, so that in near future I think public will be now even the consumable items should be lead free. So we are working on the developing the lead regulations free. And at the later stage, I think as said by, since this is very new in our country, now there is no infrastructures in terms of diagnosing health capacity. So we are now we wanted to strengthen the infrastructure for laboratory capacity to detect, and that is we are in the pipeline. Yes. And at the same time, now we are joining the international global days, where we wanted to advocate in terms of lead poisonings and preventions. And
thank you, Mr. Karma. Now, one last opportunity for both the guests. Maybe any advice that you'd like to give to the parents who are watching? Anyone? Doctor.
Thank you once again. So what we should know as parents, there is environment intoxicants like lead. It's prevalent. It's indirectly shown by the blood lead level. So what we should be aware, and what preventive measure that we should do. First of all, we should know where the child is playing. Please see where the child goes, and please especially workshop areas and where repair things are repaired. Other thing is focus on immediate environment of the child, where child spend most of the time. Keep it clean, wipe the toys regularly, and feed nutritious food. Make hand washing a routine habit. So all these measures will go a long way in preventing late exposure. And if you have any children having signs and symptoms that we discussed earlier, you can approach our outpatient department or the hospital, so that we will be of some help. Thank you.
Thank you, Dr. Mr. Karmala.
Just to supplement, Doctor, I think as now National Blood Level Survey 2024 has highlighted an urgent public health issues. So I think now immediate and I think urgent action needs to be taken care. So for that, I think all sectors, not only Ministry of Health, other sectors like trade, industries, religious bodies, and even the environment needs to come together. And I think to work to eliminate the lead content in the countries. And I think MOH like to call all the stakeholders to join us and make our country lead free and lead safe, so that we can make our future generations, children, a safer place in Bhutan.
Thank you, La. And with that, we come to the end of today's program. I would like to thank both our guests for your valuable time and your valuable insights, La. And thank you to all our viewers. I hope you enjoyed the discussion. But before I sign off, just a reminder, protecting our children starts with what we know. Until next time, stay safe, stay informed, and take care.